Hi, I'm Jacob Lancaster. I'm here to talk to you about Dr. Chopra. Dr. Deepak Chopra is an alternative medicine advocate. He's a public speaker and also a writer. He had education at St. Columba College, where he earned his doctorate. He then went on for about 6 years studying in places all around the United States. The federal government says 119 million Americans use medical prescriptions every year. Nobody questions whether or not they're necessary or if they should be taking them at all, if there's any other forms of medications that they could be taking. I work in an acute care hospital where I deliver and administer many medications, and while I try to inform the patients that I'm giving them this medication, 9 times out of 10 the patients don't even care or know what I'm giving them. So first I'd like to talk about big pharmacy, the push for medications, and why Dr. Chopra pushes alternative forms of medications. And finally, how Dr. Chopra gained influence with his admirable ability to speak to large audiences. Big Pharma has tried to suppress alternative medicine and all sorts of different types of competitors to stay on top. They monopolize the industry. Big Pharma has done its sinister best to squelch any and all knowledge and information that come from far more affordable means. Dr. Chopra is correct in criticizing Big Pharma and their plots to control markets regardless of outcomes. Forms of complementary and alternative medications have been around for centuries. Dr. Chopra sees less invasive ways to be healing, such as acupuncture, meditation, and other forms of uninvasive ways of medication. One example that I can think of is when somebody were to have an MI or a heart attack. For 1 year following their heart attack, they'll be started on a medication called Plavix, which is a blood thinner. Blood thinners are vastly known for bad bruising, being hit in the head if you're older, or having a fall and being unable to stop bleeding. What they don't push as much is diet. After a heart attack, if you have a low sodium, low fat diet, your odds of another heart attack are greatly reduced compared if you were to be eating the same lifestyle you were prior to that. Which makes you wonder if even having a blood thinner in your system for a year following your procedure is really worth the risk. Dr. Chopra used his ability to interact with large audiences for many years. This ability had helped convey ideas to large audiences around the globe. People are receiving this new alternative medication information, and honestly, they're using it. Public speaking at this high level commands notice, bringing new believers to alternative medicine and all sorts of different types of therapies. Dr. Chopra's subject matter is extremely important, so the next time you receive a new prescription, ensure that there is no alternative therapies that you might be able to use. Most people say to question everything. I say to be sure to question anything regarding your health and anything that you could do differently. Thank you.